Hello, this is Dr. Eldred Taylor, and I'm here with Dr. William Pawluk. He is one of our speakers for our annual American Functional Medicine Association conference at the Georgia World Congress Center in Atlanta, Georgia, November the 10th through the 12th, 2016. Dr. Pawluk is an assistant professor at Johns Hopkins Medical School. He is a board-certified family physician with training in acupuncture, nutrition, herbal medicine, homeopathy, hypnosis, and bodywork. Dr. Pawluk has used magnetic therapies as part of his practice for over 10 years and is considered a leading national authority on the clinical application of both static and pulsed electromagnetic fields in the United States. He is the author of the book Magnetic Therapy in Eastern Europe, a review of 30 years of research. And in November, Dr. Pawluk will be speaking on the topic, Understanding How Magnetic Fields Work in Their Clinical Applications. Dr. Pawluk, how are you doing today?
Very good. Thank you, Dr. Taylor.
Well, great. Well, great. We're looking so forward to having you at our meeting in November. And if you could you give us a little introduction to what you're going to speak about to give our prospective attendees who are considering coming? Give them a little bit about what you're going to talk about, so they'll be excited about coming. So what are you planning on presenting in November?
What I wanted to talk about is to have people in functional medicine get some understanding of how pulse electromagnetic fields can enhance not only their practices but also the health of their patients. Pulse magnetic fields, or PEMFs as we call them, have been studied and used since the early 70s in Europe primarily. There were even one or two devices approved by the FDA in the 80s for healing non-unions. And as we all know, the FDA, when it approves something, it limits very much what you can do with it. And this is one of the reasons we don't see a whole lot of pulse magnetic field therapies otherwise approved by the FDA, because of the cost, but also because they're very limiting. This is a technology that it has a wide breadth of possible actions of the body. And there's a lot of research to support this. This research, as I said, has been going on since at least the 70s with the early 70s with the Europeans, but now it's becoming more and more common to find articles written in English in Western journals. What I wanted to be able to do is to have people understand why they work or how they work, and in particular to have a sense that they're operating at a very basic level. And one of the key things I wanted to demonstrate in the presentation is that they affect the cell at a very basic level. It doesn't matter what kind of cell it is either. What we're talking about here is cell injury. So when I'm talking about cell injury, I'm not just talking about trauma to the cell, like dropping a nail onto a foot or a rock onto a foot. We're talking about all kinds of cell injuries, whether it's chemical or toxic or infectious, etc. All of this creates injuries to the cell. The problem with cell injury is that if you don't intervene early enough in the process, then you don't have the chance to reverse the injury process. And PEMFs actually are classical, and I'll show slides on this. PEMFs are classical in actually addressing each of the major components of an injury to a cell, and therefore injuries to tissues and organs. So it doesn't matter what the disease is or what the condition is, you can basically help the body at a fundamental level. Clinicians can really expand the value of what they do, not only in their practice, as I said, but also to the patients themselves. So one of my major focuses in using magnetic field therapies is to get the patients to do their own treatments at home. You can certainly do office treatments, but ideally what you want to do is be able to have patients learn how to do this on their own. There are commercially available devices, widely available now, for people to do home treatments. And physicians, I think, should become aware of these, what's available, where to find it, how to think about how to use them, etc. And these are aspects of PEMF use that I'd like to address.
So you would do it, you would have them, is this, I'm trying to understand it, how are you able to administer it in the office? Is it I think I've seen some where there's some chairs that you sit in. We actually use biomass to use infrared energy. What's the difference between what you would do in the office and what the patient would do at home?
Well, let's first of all, the office setting usually is limited in terms of how much time you could actually treat somebody for.
Right.
If we understand the levels of pathology in the body, or whether a problem is acute or chronic, if it's acute, you can often accomplish this by doing office treatments because you're going to get people through their illness process much faster. But if it's chronic, like spinal stenosis, for example, then you really need to be doing lifetime treatment.
Mm.
And it's an injustice, it's a disservice to the patient for them to come into your office 2 to 3 times a week, probably for years.
Right.
Rather than doing that, the patients should purchase their own magnetic system, and then they would do their own treatments at home.
But
at their own convenience.
I'm sorry.
Sure, at their own convenience, which is actually important for compliance or adherence, isn't it?
Right. So for acute injuries, that's more of an office-based therapy.
It can be, yes.
Okay.
If you happen to already own a magnetic system at home, then of course you could apply it to an acute problem that you have if you already own a system.
Mm-hmm.
But if you don't own a system and you're just recovering from surgery and you're having a lot of pain in a wound from the surgery, you'll recover much faster. You're less likely to have complications. You're going to heal in usually typically about half the time that it would normally take you to heal. And PEMFs are complementary to virtually all of the therapies, and they extend the value of anything that we do with supplements or hormone replacement or anything else. Anything chemical that we're putting into our body is actually absorbed by the cell better when you apply magnetic field therapies along with it. It compares to other therapies like laser or microwave, like microcurrent, because it penetrates the entire body. Every single cell in the field of the magnetic field through the entire volume of the body gets treated. So it's not a superficial treatment. It's a deep direct access treatment to the cell itself. This is one of the reasons I started doing magnetic field therapy as opposed to acupuncture. Acupuncture has strong effects, but they don't penetrate very deep and they don't treat the individual cell, whereas PEMFs do. They get at the cell individually and directly.
Yeah, because I see in your bio you practice acupuncture, and so you know the pros and cons of both of these. So you see this as a better therapy than acupuncture.
From a cost-effectiveness perspective, I think that pulse magnetic field therapies essentially treat acupuncture. They treat the system, the acupuncture system anyway. It's not as direct, it's not as focused as you can get with acupuncture. And sometimes acupuncture gives you a stronger, local effect, or even to some extent a systemic effect. But unfortunately, you still have to keep going to the acupuncturist to get your treatments. You can't do your own acupuncture at home.
Right, right. And again, it's much harder for a physician to learn acupuncture, I'm sure, than it is to learn the proper way to administer PEMF.
Apply a magnetic field.
Right, right.
Absolutely.
Yeah, because
my acupuncture training was over 200 hours of training.
Right, and most docs aren't going to. They don't have the time or the energy to do that. But this
or the money.
The money too, because when you really look at medicine, even the supplements and the medications we use, the homeopathy, a lot of that we think works by changing energy. I know my specialty is hormones, and I know there's energy fields that can actually affect the receptor of the hormone to make it act like there was actually a hormone in the receptor. You just change the structure of the receptor by changing energy fields, and the body thinks that there is a hormone on that receptor. So I'm sure there's other systems that work like that. Just change the energy, and the body responds like the substrate was actually there.
You're right, and in fact, actually, in my paradigm, tissue is controlled or made up of chemicals. But what controls the chemicals? Physics does.
Right.
You cannot have two molecules docking with each other. For example, sodium and chloride cannot become sodium chloride. It can't become salt unless the physics allows it to happen.
Right.
So what we're doing with pulse magnetic field therapies is we're applying physics principles that then cascades through the organism at multiple levels to facilitate whatever else you're doing.
Right, right. Okay.
But one of the key things about pulse magnetic fields is that it actually increases ATP in the cell. It increases the charges in the tissues. So when you're talking about receptor sites and ligands and so on, PEMFs facilitate all of that, and a damaged cell builds up charge on the outside of the cell. If you open up all the membrane channels, and sodium and potassium and magnesium and so on, and now get direct access in and out of the cell wakes up and is able to function.
Right. 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 Physics is physics and science is science. And when the body is allowed to work correctly, it's amazing how everything just gets better. And I'm sure you can do that with the by changing the energy in the cell. And that's the basic makeup of our body. So it's interesting, information, Dr. Pollock. Energy medicine. It's kind of hard to grasp, but again, physics is physics, and so we're looking forward to hearing more about what you have to present, and we're also looking forward to understanding how we can implement it in our practice. And our association, we want to make sure that we present information that the doctor can actually take back to their practice and help their patients. And this sounds like this is something that they would be able to do.
Correct. And we'll have a webinar after the conference because obviously the talk is going to be a short talk,
Okay.
and it won't allow for as much interaction as we might want to have or as we could have in a webinar.
Okay. Well, great. We'll look forward to scheduling that, and I'm sure the attendees would look forward to it also. So, Dr. Pollock, thank you so much for your time this afternoon. We appreciate you giving us a little taste of what you're going to speak about in November, and we look forward to hearing more at our conference November the 10th through the 12th, 2016.